I'm Rick Buck, and I've been a dentist for 16 years. Welcome back to my channel. Today we have an intriguing question to tackle. Is it possible to cure or reverse tooth decay or dental cavities? The simple answer is yes, it is possible in certain situations. So let's dive in and find out the complete answer. Before we begin, let's quickly understand what cavities are. Cavities are damage to the hard surface of your tooth caused by acids produced by bacteria in your mouth. This acid gradually eats away at the tooth enamel and the underlying level as well, leading to a soft, sticky, demineralized tooth that shows up as a dark spot on an X-ray and is sticky to my pointy instrument called an explorer, which is how we diagnose cavities. The decay process is a vicious downward cycle. You see, once a cavity starts, more bacteria invade the tooth, causing even more acids, which then demineralizes more of the tooth. And then more bacteria invade, causing more acids, and so on and so forth. This cycle is difficult to stop. Now I am gonna go a little more in depth. You see, your teeth are actually always in a state of demineralization and remineralization. This means when you eat, your mouth becomes acidic from bacterial byproducts, and your teeth lose important minerals in the process. To illustrate this, this is an experiment I did where my mouth turned more acidic after rinsing with sugar water, especially after a few minutes. Now this process of your mouth becoming acidic is natural. However, your saliva over a short time has everything it needs to remineralize your tooth and buffer the acidity created by the bacteria in your mouth. Actually, the truth is that as long as a cavity isn't too deep, your saliva has everything your mouth needs to remineralize even tooth decay. For example, look at this tooth. I extracted the tooth in front of it months before I took this little video. After I took out this tooth, you can see there was a remineralized cavity right here. There was no decay on the X-ray, even though there was this prominent stain. This is common to see when someone loses a tooth next to a tooth with a cavity. Because everything changes once that tooth is out, the decay will remineralize and leave a hard, dark stain like this. In fact, a lot of kids, once they have their braces removed, and because of the braces, they weren't able to clean around them very well, and plaque would just build up around them so easily. So these spots are remineralized cavities from difficult oral hygiene when in braces. And then it changes when you have easier oral hygiene once the braces are removed. So what gives and how can you apply this to yourself? Here's what has to happen and the criteria that needs to be met if you want to even have a chance to cure a tooth from a cavity. First, if the decay hasn't invaded past the enamel into the underlying levels of the tooth, which is this junction of gray and white on the X-ray, then it is possible to remineralize, reverse, and cure the tooth decay. Once it gets past what we call that dentin enamel junction, it is too easy for the decay to propagate, and it's too difficult for the saliva to reach deep enough for it to remineralize the tooth structure. So for the most part, the decay cannot pass that junction, otherwise it just gets too difficult to cure. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Most dental products have not progressed in the last 10 to 15 years, and these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best posted at the end of this video so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. Second, there has to be an extreme shift in oral hygiene. Most of the time, this means religious flossing and brushing with fluoride. And that's not it. You just can't stop with the usual twice-a-day routine. You have to do more than that. I tell the people that are interested in this, you have to also brush 20 to 30 minutes after your meals. You can watch some of my other videos on why 20 to 30 minutes after. This continuous supply of hygiene and minerals stops plaque and bacteria from colonizing and allows a constant flow of fluoride to remineralize the tooth. And now I'm not even talking about stopping there to reverse them. The new routine you have also requires not snacking, because snacking gives the bacteria a constant supply of acid forming fuel. So good luck in becoming fanatic about it. But seriously, if you can, do it. Third, what can help it is if there's a huge shift in the environment next to the cavity that can create a constant flow of remineralizing saliva or block dental plaque formation. For example, once a kid gets braces, the braces create traps for plaque accumulation. That causes cavities. But once the braces are removed, plaque no longer easily builds up and saliva is in constant contact with the cavity without the buildup of plaque, which turns it into that remineralized white or dark spot, as you can see here. So that's a shift in the environment of the cavity. Or just like that molar we looked at earlier, how it likely had a small cavity, but then something happened to the tooth in front of it. This happens so much when you lose a tooth in front of a tooth with a cavity, because now there's constant flow of saliva to that cavity. The cavity rehardens and remineralizes for whatever reason. So the environment, you can see, can give a chance for the decay to remineralize. In my practice, it kind of depends on how I approach these cavities, but most of the time I won't do a filling on a cavity in a tooth until the decay makes it at least halfway down the enamel to that dental-enamel junction. Why? First, before halfway, it is possible for the decay to heal or at least become arrested in that state. Second, after halfway, it becomes almost impossible for most people to remineralize their cavities when they just stick to their same routine and without that drastic change that I told you earlier. Remember, a lot of these patients weren't able to do the required hygiene for their diet to prevent cavities in the first place, let alone the extra amount it takes to remineralize the tooth. The third reason that I don't do it until the cavity gets a little bit deeper is sometimes what appears as a small cavity on an x-ray may actually be just a random small dark spot on an x-ray that isn't tooth decay. So holding off a few months will reveal the true nature of the cavity. So yes, it is possible to cure a cavity, but it isn't probable for most people. Early detection is key, so ensure you're going in for your regular cleanings and exams. But watch out, because you may not want to put it off, because if you let a cavity go and things don't change as much as you think they might be changing, you can end up with even bigger decay down the road that reaches the tooth nerve and causes a toothache or an infection, which will then require a root canal to save the tooth. And you could have possibly gotten by with just a small filling. So be careful. Yes, it is possible under certain conditions, but you just got to be realistic, because most people can't meet those conditions. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.